It's good to have you here. All right, everybody, welcome to Hatherleigh Behavioral Health's Coffee and Chat. I'm Courtney Asanka. I'm a licensed clinical mental health counselor, a life coach for student athletes, and a published author, one of my books being Swedish Lagom, and it talks about finding joy in just enough and balance. And one main component of Swedish philosophy is a ritual we call fika. And it's more than just a coffee break. It's about connecting and finding balance throughout your day. So it kind of pairs well with our topics today. So this is almost our version of fika. So I hope it brings you connection and some balance throughout your workday. We have some other people, master's level mental health therapist from Georgia, someone from Virginia, licensed professional counselor, and Stacy says good morning to everyone. Thank you. Today on our call, we have Andrew Flack from Hatherleigh. If you would like to say welcome to everybody and let us know a little bit more about Hatherleigh Behavioral Health.
All right, there we go.
There
Sorry,
we
I had to find
Okay.
my mute button. And anyway, well, thank you, Courtney, and it's great to see everybody. It's great to see all of you joining with us, many of you for the first time. And again, as Courtney was saying, this is really a way for us to reach out, to connect, to build community around Hatherleigh. We've actually been providing CE and CME to the behavioral health community for over 45 years. And it's hard to believe my father, Dr. Frederick Flack, was the founder. He was a psychiatrist and created really one of the very first distance learning CME activities in our field. Just a few things I wanted to share, Courtney, if you don't mind. We have a brand new podcast series that is being broadcast now on YouTube, Spotify, and Apple Music. It's called The Gold Standard, and it features Dr. Mark Gold, who's one of the leading addictions specialists in the USA, and he is using the podcast to bring conversations around addictions, both from the historical aspect and also from the current challenges and future opportunities for treatment and care. And we've got 4 wonderful interviews already in recording, and you can join up for that very easily. I'm going to put some information in the chat on the Gold Standard YouTube podcast. And as I said, please feel free to subscribe to the channel and take a listen. We also, on the YouTube channel, which I'll share with you as well, have other recordings that we'll be putting, including the recording of today's call. So again, feel free to join and share. And thank you for being there. I'll move on to back to you, Courtney, I guess. Yep.
Thank you, Andrew. Next, we have Stacy Powell, who's the managing editor of Hatherleigh Behavioral Health. Welcome, Stacy.
Good morning, everyone. It's a pleasure to be here, and we're really excited for this conversation. And we hope that you would engage, and Courtney will go over, some housekeeping rules. But we just look forward to a wonderful conversation. Thank you, Dr. Whatley, for being here as well. And basically, my role in Hatherleigh is preparing our continuing education modules, and we're always looking for new faculty. So if you're interested in contributing and doing some writing, feel free to put something in the chat. Okay, thank you so much.
Thank you, Stacy. A few other housekeeping before we start. We ask you guys to mute yourselves, and we'll have some question and discussion at the end if we have time. And if you have other questions, feel free to put them in the chat. So we'll start today. We're talking about connections, relationships with people, and technology, and how they all go hand in hand. So I will introduce our experts today. We have Dr. Lori Whatley and Taino Bendz. So Dr. Whatley, if you'd like to introduce yourself and tell us a little bit about your writings and clinical practice, that would be great.
Okay. I'm Dr. Lori Whatley. I have been doing this for several decades. Absolutely love my work in the field of psychology. Did my doctoral dissertation on the ways that our digital devices disconnect us. And that was quite a while ago that I did that. And now it's more relevant than ever. So now I've talked a lot about how disconnected we are, but now I'm talking and sharing with the world how to be connected and the benefits that we gain from that connection.
Wonderful. Thank you. And Taino, could you introduce yourself a little bit and tell us your expertise in this area?
Yeah, definitely. And also, I'm dialing in from Sweden, so perfect time for a Swedish fika. I approached the theme from a bit of a different topic. Or angle, I should say. I'm an engineer, and have worked with this. I have worked with digitalization, and sort of new tech, and then in the last sort of 7-8 years, started looking at some of the things that Dr. Whatley explained, like how it affects connectivity, health, all these things. Written the book that's shown there, and approach it from a very practical angle, practical tips and everyday things that people can do to increase their connection, mental health, physical health, focus, and relationships. So super happy to be part of the conversation.
Wonderful. Thank you. And we'll go back to you for certain tips and strategies. So Dr. Lurie, what have you been seeing in your clinical practice that made you interested in this topic and even starting to write, your books? What clinical problems were people presenting to you?
Well, depending on the client, if I had teenagers come in, maybe their parents brought them in because their grades were dropping. They couldn't understand why. They were doing poorly in school, not interacting during the day as they typically would. And almost always I could trace it back to they had their digital devices in their rooms at night, and they were staying up all night on their devices, and they weren't getting their sleep. And so this became a trend. And also, I have seen with that age group and the people going off to college some gaming issues, and helped families intervene and get their kids back on the right track as far as getting off of the games and getting into school, because they were isolating when they would go off to college. And there's been a lot of studies around that, and it's all very interesting. But then also I would see couples that would come in, and they would have, be having relational problems, and maybe they were one was always on their phone. If they were even out for dinner, one was on their phone and the other felt dismissed. So I noticed that in many areas of our lives, our digital devices were actually distracting us and keeping us from connecting with others properly. And we are built for connection as humans, so that there's many problems that come with this when we are not connected properly.
Mm-hmm. Have you found with your clients that they have a willingness and a motivation to want to change their behaviors, or is it you almost pointing out how they could connect better, and that usually means getting off the device?
Right. It depends. Obviously, teenagers are not real excited about giving up their devices, but they see the positives when they do, and I think they do well with that, and their families get involved, and so they see the benefits. Most people enjoy the benefits of being connected, because when they're disconnected or when they're on their devices too much, they notice that they feel anxious. They notice they have so many tabs open in their brain all the time, and it's just not a great way to feel. So once they've actually been able to pull away from that some, they do enjoy it, and it is something that they're willing to balance. I think the important thing is we have to realize our digital devices serve very important purpose in our lives. I mean, look, we're here having this meeting thanks to our digital devices. However, it's balance, like everything in life.
I couldn't agree more. And that's what Swedish Lagoma is all about. And it is, because nothing is all bad or all good. And technology is here. And, I love my phone and I love technology. And I think most people do. And we couldn't really live without it. So, right, it's about finding that balance and how we use it to connect even with people, rather than not connect with the people around us.
Right.
What were some of the strategies, if you could kind of tell our listeners the main strategies for, disconnecting? I know you did was it a day without a phone? Could you tell us more about that?
Yeah, absolutely. So that's kind of what started my journey into this field was 8 or so years ago when my kids were toddlers and running around at playgrounds, and I started realizing exactly what Dr. Whatley is talking about, the disconnection that appears when a parent is on their phone instead of looking at their child. And it really, really struck me. So I thought, like, am I the only one seeing this and having an issue with this? So I started an initiative called Phone Free Day to raise awareness and also, I guess, see is there are there other people out there who feel the same? Not today, there's different movements around the world. It's a much bigger awareness. But what I found, and which goes very closely to what Dr. Whatley is talking about, is like if you scratch a bit on the surface, there is really a willingness to change. If a lot of people go around with this gut feeling that this isn't really how I want to behave. I don't want to push the swing with one hand on my child and scroll with the other, but I do it anyway because of the dopamine kick and the short-term stimulation. But when you start thinking about it, people do have a willingness to change. And the first tips for me is always, awareness and intention. Just like we've already covered, what we're doing in this call is using technology intentionally for a purpose. We are connecting with each other. We're using it in a meaningful, purposeful way. So that's always the first, like, am I using some technology as a tool for a purpose, or is it distracting me from something else, something more important?
Mm-hmm. Right, I agree. It's being more present, right, in your everyday interactions and using and being purposeful and intentional. Dr. Laurie, you had said too about, reconnecting with your spouse or family. And if you could speak to a little, I think, with my clients and the parents that I see, a lot of times their number one thing is, I'm just going to take the phone away. And I said, okay, but, taking something away isn't connection either. And they think, once I take the phone away, everything's going to be solved and we're going to have this great relationship and this family time. But what are some of the things that the parents could, how can they reconnect with their either spouse or children rather than just thinking, if technology goes away, everything will be fine?
Well, I think that is just the beginning. I think they still, as you said, they still have to connect. They still have to find ways to connect. I think having meals together, we know from research, having one meal a day with your family members, we've been able to measure the stability that brings in individuals as they're launched out into the world. Of course, we want that for our children. So at mealtime, we don't have our phones at the table because just having them laying there is a distraction. We don't have them at the table. We have conversations. This is a wonderful time to socialize and to teach children how to have conversations. So when they go out into the world, they're able to converse with other people and have eye contact. And those are the ways that we connect with our kids at night. We say, hey, how was your day today? In our family, we play the high-low game. What was your high today? What was your low today? And we get them talking and we connect in that way.
Right. With families, Taino, what are some things that families, I guess, could do together to help with connect and even maybe connect using technology so they realize, kind of teaching kids the appropriate ways of using it, and adults?
Yeah, I think that's a great point that we can also use technology to connect. So, for example, now we have a 1-year-old. I've got 3 kids, a 9, 7, and 1-year-old. And with a 1-year-old, we call my mother at times video call. So some of the recommendations are for kids under 2 to very much limit the screen time. But when you do use it together with an adult for a purpose. And video calling so she can see her grandmother who doesn't live close is really meaningful. For the older kids, we talk a lot about it. And trying to teach them balance as well, so it doesn't become that we take it away or we limit it. We talk to them. I also believe a lot in being vulnerable, saying, hey guys, now that they're 9 and 7, you can talk with them a bit more, and saying, I also struggle with this. I have a hard time. My 9-year-old always teases me about having too many tabs open in my web browser. That's my weakness. And he comes to me and says, Dad, now you got 20 tabs open again. And I'm like, yeah, I know. That's what I struggle with. So trying to teach them, also what they miss out. So for example, if they have a friend coming over to play, the sun is shining, and it's like, okay, if we stay indoors, we can do this, play on the iPad, we can do that at any time, but then we choose that over all these other things. So I think really talking to them, whether they're young as my kids or older as teenagers, saying, what good experiences do we have with the devices, what bad experiences, how can we, and involve them as well, involve them in the sort of rule setting.
Courtney?
Right. Yes.
Courtney, I was thinking maybe we could talk a little bit deeper, specifically around technology addiction, and also the mental health consequences of being immersed in technology for the better part of a day. I mean, because that's really what we do if we're at work and then go home and then are on technology as well. So if you could both, Dr. Lori and Courtney, share some deeper insights into the risks and the, sort of the mental health consequences of immersion in one's device. I think that's something that really is important to hear about.
Dr. Lori, would you like to go?
Absolutely. Well, we know that our devices are created to addict us in the number of tabs open, it is all very addictive. There are, well, if you look at social media platforms, the way they're, so that we go for the likes, we go for the dopamine hits that Taino mentioned. And all of that is part of the addiction cycle and the addiction process. And so if we have a tendency towards addictions, we can easily become addicted to our digital devices and unable to put them down. And then, addictions come in 2s and 3s. So if we have that addiction, then we might isolate. We might go into maybe not moving our bodies and eating too much, or just one. It can kind of be like the domino effect in some ways in our lives if we're not intentional about the way that we use it. But if we know that we have that tendency towards that sort of addiction, then we're able to be mindful of the way that we use our devices and use them with balance and intentionality.
Right. And I think now it's what both of you said, it's educating, the user. And now that we know more about, how social media platforms are set up, with more knowledge, we supposedly can do better. And I think you're right. It kind of does. It's like this vicious cycle. So usually, kids or adults who have a more balanced life, spend more time with family, go outside in nature, have other activities, they're not as attached to their phones because they don't want to be. They have other things kind of fulfilling that void. But it's the children who aren't securely attached to an adult, that it used to be, they would attach to their peers, and now it's children are actually attaching to their phones. And that's where they're getting all of their, their phone is acting as like their compass and their guide in life, when really it should be, a parent or a caregiver. And I think that's the really concerning part, is that, and again, we're all on social media. That's how we advertise and market, and it can be a good thing. But if that's the only source of, your dopamine hits and your happiness and your confidence, then that's a really slippery slope, because you don't have control over what is out there and what you're seeing. Especially now, half of what we're seeing is, I don't even know if it's real anymore, the pictures and the stories. So if you're a developing teen and you have all that information in front of you, and you don't have a caregiver that's able to process it with you and go through it with you, then, essentially that teenager is maturing and raising themselves with knowledge that it's probably not even knowledge. I mean, who knows? Some of it's not real. And I think that's what we have to focus on. So again, it's psychoeducation to the client, no matter what age they are. And then also, Dr. Lori, to your point, is connecting the family, and how, the family aspect of, I want everybody to feel this way. I'm not going to just say, kids, don't be on your phone. I'm not going to either. And I think, not having those connections, that leads to the more serious, addictions, and technology addictions that we're seeing, because it truly is, if you think about how a child feels when they get praise, from their parent, and like good, securely attached praise, right? That's what kind of drives their behaviors, and that's what they want, and it makes them feel good. That's what they're getting from the phone. So if they start that at a young age, or video games, or whatever, if they start that at a young age, that's what's going to keep them going and going. And once it starts, it's very hard, to stop. Not that people can't change, but the sooner you start connecting with, your family or your spouse or your loved one or your partner, the easier it will be to maintain those connections, later on in life.
I definitely agree. And I think it's also really important to look at our own behavior as well, which we've touched upon. It's so easy to talk about, kids or teenagers, but it starts kind of with us, the old saying that a child does what they see, not what we tell them to do. And also I meet so many adults who are struggling with this, and even if they're not prone for other types of addiction, this has almost become normalized. Whether it's highly skilled professionals in whatever industry, people you see all around, the being attached to your phone has become normalized. We start our day, we wake up, we pick up the phone, we use it as an alarm, check email or news or social media all the time. This information overload, and that's how we start our day. We commute, everyone's quiet. I reflected on that, how quiet public spaces are now, because everyone's on their phone, come to work. So it's like I feel like we need to start this discussion is great, other discussions that are happening, and start challenging what has become the norm. Because to Andrew's question or point about the health issues, is that it is really affecting mental health, but also physical health, which affects mental health as well, relationships, productivity, efficiency at work. Like, it has such a massive impact. So I think it's important that we acknowledge that, and then start seeing, how do we change?
Right. Dr. Lori, are you familiar with, or do you do any type of like specialized treatment or counseling for like technology addiction? Is it more of a like substance use
Uh,
addiction, or is it more of the CBT?
Absolutely. I work with people who, um, I mean, there are many things that you can bring into that sort of therapy. One thing I loved what he said about, loved what Taino said about us modeling as adults. We have to model for the children. We don't tell them what to do. We model that for them because they watch what we do, not what we say. So I like that. Also, want to say that, you know, when we're talking about children on devices and the things they're seeing, remember they're seeing them with undeveloped brains. Their brains are not fully developed. So for them to process everything they're seeing in a healthy way without their brains being fully developed, they don't have all the tools to do that until I think males are 28, girls a little bit earlier as far as brain development completion. So imagine that. Imagine the things that we see on here that confuse us. Imagine kids seeing that without having all the tools. So back to your question, yes, absolutely. I do work with people around just, you know, putting their devices down, being aware of how it affects their sleep patterns, how screens in general affect us, and helping them overcome those tendencies to live a healthier life.
Right. If we could switch gears a little bit and talk about telehealth and telemedicine as, you know, clinicians and serving our clients. I'm just curious. I know I'm 100% telehealth still. I don't know about how do you run your practice?
Absolutely, I am 100% now, mainly because that I had always done that because I saw many people internationally in places where they did not have access to mental health. Before COVID, but then after COVID, people just enjoyed the not having to drive an hour to get to my office and then drive an hour back to work. They realized that, you know, it just worked better for them to do telehealth. So I'm completely telehealth now.
Do you have any tips on, because I know I have certain clients that would, you know, love to be in the office. They feel like we can connect better. I feel like I connect pretty well, you know, through the screen, but everybody is different. Do you have, and sometimes ages are different. I know the adolescent population, they're very used to talking through a screen and they almost prefer it. Sometimes with younger children, it can be more challenging because we don't have, you know, the togetherness. And I think sometimes with older adults, they're not used to, you know, talking to someone on a screen because they haven't grown up with it. But do you have any tips on how to still establish that, you know, therapeutic connection and the rapport through the screen?
Well, first I want to say young children, I would not see through telehealth. Would not at all because most of them do well with play therapy, which needs to be in person. So, you know, back to the brain development and the way that they best connect, don't recommend telehealth for small children. And, you know, making eye contact and is a great way to connect with people. And so when you're having these sorts of conversations, you know, having them on a screen, you can have that that connection. I have not had a problem connecting with my clients virtually. I have found that actually people who I work with in this way move forward faster because they have more access to me. So it's been a positive.
Okay.
Can I add something there, Courtney?
Yes, please do.
I totally agree with the eye contact and also addressing and avoiding multitasking. You know, both on the I'm not into telehealth. I do coaching through screens. But it's so easy to, you know, to have someone and you hear them sort of doing something else or pressing on the keyboard, and like addressing that and saying, okay, you know, we taking advantage of technology so we can meet now without driving an hour back and forth. But it also means that we both need to be quite, you know, strict on ourselves not to do anything else. Close down all the other programs, put your phone away, act as if you're in my office, sort of thing. So I think addressing that, I think, is a really important point as well.
Right. Again, it goes back to that purpose and being intentional and knowing what, you're doing. And I think that's a good tip for all technology use. Like when you're using it, then use it. And then when you're not, make sure you find that balance throughout the day. So, you go outside or you connect in other ways. But when you're using the technology, really use it and make the most out of it.
Say, Courtney, I wanted to add a couple of thoughts. First, Taino, about modeling. I was in a restaurant several years ago, maybe 6 or 7 years, and it was dinner time just for dad and son. And what I observed was the flip. So instead of the parent modeling to the child, it was the child who pulled out their phone, started playing on their phone. So what did dad do? Dad pulled out his phone, and that was the rest of their dinner together. And I was like, whoa, this is really so sad. And what a beautiful opportunity for bonding with your child. And they both kind of separated at the table and disappeared into their own digital worlds. And part of, I think, the impact of the technology is people don't know what to do with themselves. And so it's almost becomes an automatic behavior. And, I personally struggle at times with a little bit too much technology in my life. And I have to make hard and fast ground rules about what to do with the phone, where the phone belongs and where it doesn't belong, and how to adjust that way. The other comment I wanted to make, Dr. Lori and Courtney, has to do with HIPAA and telehealth. The folks over at Zoom are able to actually sign off a BAA for HIPAA compliance. So do you have any comments on the approach? Is that HIPAA concern something you bring to the telehealth sessions? Do you have clients sign off on that? How does that work?
Yes, we do. And they sign a consent, a different consent for telehealth. And we have different platforms, that are all HIPAA compliant. But I remember starting out during COVID, when you're in an office, who's in the office with you. But when you're on a screen, I didn't know if people were in the room, who was coming in, who was coming out, who was listening. And so we kind of went through all of that. And sometimes I'd have to say, are you in an area where you, can talk? Can people hear you? And I had a lot of moms take their sessions in their car, like in their driveway, because it was more private. I mean, you can talk quietly, but if you're in the house with people, they can hear you. So it was kind of a shift in, how do we still maintain confidentiality and have that safe place, but through telehealth. And on the flip side, now people sometimes like it better because they can be in their home and they feel, that's their safe place. And they can kind of control the environment a little bit more, than in the office. But again, right, it's having that discussion and telling people what, the pros and cons are and how we have to adjust to a different way of therapy.
Absolutely.
Would you like to engage the community, perhaps, Courtney?
I would. I was wondering if anybody had questions or treatment questions, if they are practicing telehealth, if you've run into any issues or challenges with clients in telehealth, or if you had any questions on how, with technology addiction or how to best connect with clients. So if people want to raise their Zoom hand, we can call on you and then unmute yourself, or feel free to put it in the chat if you're more comfortable with that.
And I'm also thinking too, maybe if you don't have a specific question about telehealth or addictions to technology or just basic technology etiquette, let us know why you're here. We'd love to know what brought you to the conversation today. That would be something we'd really appreciate. If you want to feel free and share.
I'm wondering too, if anybody's seeing, during COVID, obviously there was a huge bump in telehealth, and I think afterwards too, but I'm wondering now if people are seeing that people want to go back to in-person therapy or medicine, because I've seen a little bit of an increase, wanting that, unless it's for, convenience issues. But it's a lot of providers, I think, are offering a hybrid of telehealth. They'll come in the office like once a month and then do telehealth, the other weeks. Again, find that balance.
I have a question. I no longer practice. I'm the CEO of V Solutions Consultant, and we provide all the training, staff development for mental health and addiction counselors in the state of California and also in Nebraska. You guys mentioned addiction and use the term addiction as it referred to technology. And although I do agree that there's so many aspects, that may indicate that a person have an addiction. We definitely use the DSM as far as how we determine addiction.
Mm-hmm.
I guess my question is, how do you label addiction when it comes to technology? What are the criteria used? Is it the same criteria we use for substance use disorder?
Dr. Laurie, do you want to answer that?
I think you completely use some of the same criteria. I think if we think of it in terms of, addiction is a form of escape. And what are we escaping? And certainly we see that our digital devices and our screens are a form of escapism for some who are not able to balance their use of these items.
So, and the reason I ask the question is because when we use that term addiction, and for people, especially in the substance use disorder community, in the addiction community, we know that there's a certain criteria that we follow in order to give that diagnosis. And two of those criteria, especially when it comes to addiction, because we know it's a brain disorder, and I understand that there's a maladaptive use of technology as well. And I just want it to be clear, especially for, not just us in mental health, but people who do suffer from addiction, so that they can understand the guidelines that we go by in giving that designation to someone or that diagnosis. Does the person, experience withdrawal when they cannot have the device? Is there a certain level of, do they need more of the device than they used to when they first started out? So is there a tolerance that is developed to it because of the use of the device? So there's a lot of different things that we have to look at when we're determining, or when we're using that term addiction. And I just want all mental health and addiction providers to be on the same page when we are designated or using that designation, the term addiction, especially for those who are suffering from this maladaptive use. Because just like with substances, there are people who have a maladaptive relationship with substance, and they may not necessarily meet the criteria for addiction, but certainly for substance use disorder. And I'm wondering if that also applies to technology. And how do we, as a mental health or addiction group of people, decide, or how do we, what type of I guess, what criteria are we following, and are we all on the same page? That would be my question in determining that.
I think just as with, substance abuse, everyone is not on the same page always, but I think we can move closer to using some of the same criteria to get onto the same page. One thing that you pointed out brilliantly, the withdrawal. I always say to people, okay, if you're considering that you may not be using your device in a balanced way, let's do a little test here. You put that in a drawer and you go run some errands today, and let me know how you get through that time. What does that feel like for you when you, and some literally, I've had people have a panic attack because they do not have their phone with them. That doesn't happen often, but many definitely feel anxiety, high levels of anxiety without their phone. They definitely experience the withdrawal. And then another thing, that when we're talking about addictions, is how is this affecting your relationships? And of course, that was one of the first things that drew me into studying digital devices and relationships and in my practice, because it can interfere in relationships. And are you able, as Andrew said, when you're out at dinner and you're both down in your phone, I mean, can you put that away and interact, or is that just impossible to do? Looking at it from some of those angles, I think, is very helpful.
I think, Nola, you bring up a good point, because I think we're just starting to, research this more, and much more research is needed. Because, the brain, how it does affect the brain. Is it more of a psychological addiction? Is it a learned behavior? Is it, something that, not that you can necessarily control more, but I think, right, when you hear the word, addiction, it has a different, almost connotation. But yeah, I think it's something that needs to be studied much more seriously than just, just put your phone away. Because I think for certain people, right, in the brain development, it's different for everybody. And I think there's different levels of it. But you're right. I mean, I don't think I have actually ever diagnosed somebody with like a technology addiction, because I don't want to, quite frankly, put that label on them. I want an expert to do that with much more, expertise in that area. So I would work more with the behavioral, strategies. And sometimes we find that works great, and that's all we need. And for other clients, it is truly something else that they are, connected with, and addicted to, and need a different course of treatment or a different level of care. But yeah, I think that's
Courtney, one thing I want to jump in on, and I'm going to turn it over to Stacy in a moment, is that we have published continuing education content specifically on computer addiction years ago, before smartphones, before the sort of ubiquitous nature of the internet. So, and Stacy, you also were referring, maybe you have another content piece that we can share.
Yeah. Yes, I'd be happy to share a couple of articles that we've published in our continuing education journals, one on problematic social networking site use, and also on internet addiction. So if you give me a moment, I can try to make that available here, or we can email. I'll put my email in the chat. So excuse me, I'll be happy to send it to the group, if that would be of interest to everyone.
Oh, that's great. Thank you so much, Stace.
Yeah, thanks.
good. Are there any other questions from participants or anything in the chat? I don't see anything.
I don't see any questions. It's now 11:45, and maybe we can, continue for a few more minutes with final thoughts and takeaways. I think would be really, really helpful. I think it's very special to have Dr. Lori and Taino together on this call, because they bring such interesting perspectives, both in the therapeutic setting and also sort of in the world at large. So that's my thought. What do you think, Courtney?
I think that's great. If you guys want to give us some final thoughts or takeaways, that would be wonderful.
And in the meantime, I'm going to put links to their books in the chat as well, for anybody interested, as well as a link to your book, Courtney, on Swedish lagom, because that's a conversation for another day.
Mm-hmm. Dr. Lori?
Great. Thank you so much for having me. This has just been a wonderful conversation. And I applaud you all for taking this on. I love the work that Taino is sharing with us, that he is doing across the world. So we know that this is an interest that is universal. It's something we're all noticing. And I think the important thing is for us to notice how we feel without our device. Mm-hmm. That's a great way for us to measure where we are in keeping it in balance. And notice, as Andrew pointed out, notice when you're having a meal with someone, how it feels to be connected to them without your device, as opposed to both heads down, finger scrolling, but looking into each other's eyes, talking. These are the things that are truly healthy for us, and moving back towards them and putting our phones away is essential, I think.
Thank you. Taino?
Huge thanks for me as well for the invitation and possibility to be a part of the conversation. And yeah, I also just want to send everyone this, what we've talked about, the awareness. Keep this in mind when we meet in our private lives, but also, you know, people working in clinics and so on, because it is such a huge part of people's lives, and can be something that affects them in a massive way, even though it might not seem so at first. Like Dr. Laurie has talked about with relationships or underlying health issues that is affected from tech. So not to lose track of that. And small thought on the addiction conversation. Again, I'm not a clinician, and sometimes it can be useful to label it, and sometimes not. But where we do or not, again, recognizing the impact that tech is having, and that is quite a new, still, you know, 20 or so years into the smartphone era, it's still fairly new. And I mean, if we can act even before all the research is conclusive, we can help people a lot. Yeah, thanks. And any questions, happy to answer anything after.
Thank you. And I just want to thank everybody for being here. We have another coffee and chat next month. It's going to be with Dr. Kay Towns, who is an expert in grief counseling. So if you want to join us with that, I'm sure Hatherleigh will send an email with the link and the date and the time. And I hope to see everybody there again.
Great, thank you.
Thank you so much, Courtney. Thanks everybody for joining. Thank you, Taino. Thank you, Dr. Laurie.